Medical disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, and always get proper treatment for serious medical conditions. Legal disclaimer. Use only legal measures to combat the virus and cooperate with government officials, first responders and healthcare workers to make the coronavirus a thing of the past and create a perfect society ASAP. Use common sense, logic and help your fellow humans if necessary, also to lower the risk of being vaccinated mandatorily ourselves and to end the pandemic as soon as possible. The objective of my videos is not to slander people nor to incite or trigger people, but to do the opposite, exposing it when people are wrongly accused and to create universal peace, world peace or just peace on earth. People are innocent till proven guilty in the court of law. One who knows of evidence must testify, not to convict anyone without a fair trial. Greetings, spear beings, greetings, supreme being. We are all the human race. Our common enemy is death. Welcome on Perfect Society. I'm Ulrich Hofman and this is the broadcast. AstraZeneca CEO Soriot says fast-tracked COVID-19 shot will protect for just 1 year. Okay. Well, when talking about this stuff, thinking about it, it may come to mind that there are people that want to reduce the global population to 500 million. They claim that this is not sustainable, we are not sustainable, 7 billion people have to die, and we can all wonder about how they're going to do this.
It's going to have to go to 7 billion people.
First, we've got population. The world today has 6.8 billion people. Now, if we do a really great job on new vaccines, we could lower that by perhaps 10 or 15%.
So he's talking about reducing the global population with 10-15%. That's over 1 billion people, though at the moment there are still less than 1 million coronavirus deaths. Globally 0.005%. People can check worldometers.info, 18th of June 2020. So perhaps that's why they don't allow them to make a vaccine that will be effective for over a year, for longer than 1 year. This is the FiercePharma.com website. But the first article I found was this one, brief: AstraZeneca to supply Europe with up to 400 million doses of Oxford University's vaccine at no profit. That's Reuters reporting it, Reuters.com, and cityam.com reports AstraZeneca CEO coronavirus vaccine will likely protect for a year. CNBC.com AstraZeneca COVID-19 vaccine likely to protect for a year, CEO says. AstraZeneca agrees to supply Europe with 400 million doses of COVID-19 vaccine, pharmalife.com, and we have France and 3 other EU countries signed deal for AstraZeneca COVID-19 vaccines. And that it's tiny doesn't mean it cannot be deadly, of course. list of epidemics caused by vaccinations also makes that clear. And I think only this article sheds more light on the name of the vaccine and what type of vaccine it is. That's contractpharma.com. AstraZeneca to supply Europe with 400 million doses of COVID-19 vaccine. So which one should I read first? Anybody in the chat? I can just pick one. Perhaps this one is most fun. And then we can study vector-based vaccines more. Of course, some people would refuse the vaccine if it would contain GMOs, genetically modified organisms, any animal products. They don't want that in their bloodstream. And I've covered the effectiveness of colloidal silver, which destroys SARS coronavirus, 2 studies that prove it, and the FDA has no studies to back up their claim that it would be ineffective or unsafe. And I've covered that in a previous broadcast. So it's about making tons of money, and they cannot do that with colloidal silver, cocaine, heroin, and cannabis, Rockefeller drug laws. All covered in my previous broadcast. So let's start reading this article.
AstraZeneca to supply Europe with 400 million doses of COVID-19 vaccine. The potential vaccine was developed by the University of Oxford. AstraZeneca is looking to expand manufacturing capacity to meet demand. AstraZeneca to supply Europe with 400 million doses of COVID-19 vaccine. Contract Pharma staff June 15, 2020. AstraZeneca has reached an agreement with Europe's inclusive.
Of course, what we see here on the picture is impossible. Checking if my mic's working. So they cannot inject it into the variants directly, they'll inject it into people's bodies, of course.
Vaccines Alliance, EVA, spearheaded by Germany, France, Italy and the Netherlands, to supply up to 400 million doses of the University of Oxford's COVID-19 vaccine, with deliveries starting by the end of 2020. The EVA aims to accelerate the supply of the vaccine and to make it available to other European countries that wish to participate in the initiative. AstraZeneca continues to build a number of supply chains in parallel across the world, including for Europe. The company said it is seeking to expand manufacturing capacity further and is open to collaborating with other companies in order to meet its commitment to support access to the vaccine at no profit during the pandemic. This agreement will ensure that hundreds of millions of Europeans have access to Oxford University's vaccine following approval, said Pascal Soriot, Chief Executive Officer. With our European supply chain due to begin production soon, we hope to make the vaccine available widely and rapidly. I would like to thank the governments of Germany, France, Italy and the Netherlands for their commitment and swift response. The company has recently completed similar agreements with the UK, US, the Coalition for Epidemic Preparedness Innovations and Gavi, the Vaccine Alliance for 700 million doses, and it agreed a license with the Serum Institute of India for the supply of an additional 1 billion doses, principally for low and middle income countries.
Countries. Anyway, it was highly irregular that the first time the speech engine read the word supply, or the second time it said supply instead of supply. You can rewind it. Though it was spelled correctly, so it's... how is that possible? Perhaps macros in the online article or something.
Total manufacturing capacity currently stands at 2 billion doses. Oxford University last month announced the start of a Phase 2/3 UK trial of AZD1222 in about 10,000 adult volunteers. Other late-stage trials are due to begin in a number of countries. AstraZeneca recognizes that the vaccine may not work but is committed to progressing the clinical program with speed and scaling up manufacturing at risk. The company's comprehensive pandemic response also includes
middle-income countries, not com countries.
rapid mobilization of AstraZeneca's global research efforts to discover novel coronavirus neutralizing antibodies to prevent and treat progression of the COVID-19 disease, with the aim of reaching clinical trials in the next 3 to 5 months. Additionally, the company has quickly moved into testing of new and existing medicines to treat the infection, including the Colavi trials underway for Cockos, acalabrutinib, and the DARE-19 trial for Farxiga, dapagliflozin, in COVID-19 patients. AZD1222, CHAdOx1 in COVID-19, now known as AZD1222, was developed by Oxford University's Jenner Institute, working with the Oxford Vaccine Group. It uses a replication-deficient chimpanzee viral vector based on a weakened version of a common cold, adenovirus, virus that causes infections in chimpanzees and contains the genetic material of SARS-CoV-2 spike protein. After vaccination, the surface spike protein is produced, priming the immune system to attack COVID-19 if it later infects the body. The recombinant adenovirus vector, CHAdOx1, was chosen to generate a strong immune response from a single dose, and it is not replicating, so cannot cause an ongoing infection in the vaccinated individual. Vaccines made from the CHAdOx1 virus have been given to more than 320 people to date and have been shown to be well tolerated, although they can cause temporary side effects such as a temperature, influenza-like symptoms, headache or a sore arm. AZD1222, previously known as CHAdOx1 in COVID-19, is a vaccine currently being investigated for prophylaxis. Drugbank.ca. The AZD1222 coronavirus vaccine candidate, formerly known as CHAdOx1 in COVID-19, is made from a virus, CHAdOx1.
Okay, I put that in my chat remarks list, so I can put it in a chat somewhere. Okay, I found it on Wiki. Let's see if there's also an article about AZD1222. I've got an answering machine that can talk to you. So will Tutu also get it? Wow. Clinical trials started in 2020. That's a pretty long list on Wikipedia. CIA Vatican edited encyclopedia, according to Agency France Presse and other mainstream media. Casino biologists. Casino Biologics, Institute of Biotechnology of the Academy of St. Martin in the Fields of Military Medical Sciences. Okay. ACD 1222, University of Oxford, AstraZeneca. Vaccine candidate, developer, sponsor, and the technology is adenovirus vector. Vector-based vaccines or something. Let's see if I have something in my remarks about this. My name is Vector. Graphics treatments reportedly use adenovirus-based vector vaccines, which are widely used against various infectious diseases or cancers. More info about graphics then. Graphics will distribute the vaccine to other countries for free, Fox News. Graphics is working on universal vaccines with the aim to provide worldwide protection, unquote. Graphics.com/products against HIV. Graphics has no antigen vaccine. I've covered these companies receiving funding of Bill and Melinda Gates in previous broadcasts: Moderna and AstraZeneca. Let's see if I can find that writing. Okay. Ben said Bill and Melinda Gates Foundation gave 100 million to Moderna to develop Zika vaccine. Looks like Gates is chums with Moderna and AstraZeneca too. Okay, I have some more info. About graphics.com.
GraphX's treatments reportedly use adenovirus-based vector vaccines, which are widely used against various infectious diseases or cancers, meaning they are genetically engineered. My name is Vector.
Well, I think that was the part that I wanted to find. I've covered it in previous broadcasts already. So let's move on. This may also be interesting in relation to the vaccines.
170 global groups call for a moratorium on new genetic extinction technology at UNConventionedgroup.org. December 05 th 2016. Gene drives, developed through new gene editing techniques, are designed to force a particular genetically engineered trait to spread through an entire wild population, potentially changing entire species or even causing deliberate extinctions. A gene drive is a tool that forces certain genes to be in a species population. Gene drives do this by greatly increasing the chance a certain gene is passed on to an organism's offspring. So, like with the party invitations, gene drives spread a gene through a species population. Escabiologist.asu.edu. How does CRISPR-Cas9 technology allow a gene drive alter a normal inheritance pattern? CRISPR-based gene drives bias the inheritance of desired alleles. Consider an altered allele in the germline, cells that make eggs and sperm, of an organism. The CRISPR gene first guides the Cas9 to the target site on the wild-type chromosome. The Cas9 then makes a double-strand break in the DNA at the target site. Synthco.com.
So I think that has more to do with Bill and Melinda Gates vaccine. It has to go to 7 billion people. And the AstraZeneca vaccine that may be effective for a year is a vector-based vaccine. So we can find out more about that and first read one of the articles.
Bill Gates calls for 10-week shutdown in U.S. money control. 11K views 1 month ago. A study published in The Lancet July 2015 states unambiguously that the most common adverse event reaction or side effect of Merck's Ebola vaccine identified during a trial in Guinea in 2014 was getting Ebola. The interim results state on page 6, 7. As of July 20, 2015, a total of 43 serious adverse events had been documented among eligible and consenting trial participants, including 27 confirmed cases of Ebola virus disease. See Appendix. For clarification, the following executive orders, now recorded in the Federal Register, and therefore accepted by Congress as the law of the land, can be put into effect at any time an emergency is declared. 10,998 seizure of all food resources, farms and farm equipment. 11,000 seizure of all civilians for work under federal supervision. 11,000 for Housing and Finance Authority may shift population from one locality to another. Complete integration. The President has the power to seize property, organize and control the means of production, seize commodities, assign military forces abroad, call reserve forces amounting to 2.5 million men to duty, institute martial law, seize and control all means of transportation, regulate all private enterprise, restrict travel, and in a plethora of particular ways, control the lives of all Americans. Most of these laws remain a potential source of virtually unlimited power for a president should he choose to activate them. It is possible that some future president could exercise this vast authority in an attempt to place the United States under authoritarian rule. While the danger of a dictatorship arising through illegal means may seem remote to us today, Recent history records Hitler seizing control through the use of the emergency powers provisions contained in the laws of the Weimar Republic. Joint Statement, Sens. Frank Church, DID, and Charles Matthias, RMD, September 30, 1973. Trump warns of civil war if impeached. The View. The View 478K views 8 months ago. Coronavirus, tiger at Bronx Zoo tests positive for COVID-19. BBC News 320K views 2 months ago. New research shows COVID-19 patients who test positive second time may not be infectious. NBC News 62,032 views May 19, 2020. Professor says only 10% of people with coronavirus develop antibodies. Daily Mail Middelland.
So, who can disprove to me that SARS-CoV-2 is an antibody-dependent virus?
Israelis protest against Netanyahu's plan to annex West Bank. Al Jazeera. Israeli left's show of strength highlights weakness of anti-annexation protest turrets. Heating up the North Pole with ionospheric heaters to relocate everyone into smart cancer cities.
Well, I heard that on the radio, so I still have to find the news articles about it. And then I can do a broadcast about it, but as long as it's not in the news yet, then I cannot cover it. ACD 122. Let's go back to the wiki article and then we can read one of the mainstream media articles. And you could argue it's better not to read it. Phase 1-2 randomized placebo-controlled multiple sites, 1,000 participants. Pending phase 1 report, etc. United Kingdom. Location. University of Oxford, AstraZeneca. And we were gonna check vector-based vaccines. Chimpanzee viral vector-based. A live vector vaccine is a vaccine that uses a chemically weakened virus to transport pieces of the pathogen in order to stimulate an immune response. And the pathogen is a bacterium, virus, or other microorganism that can cause disease. Google.com, and that's from dictionary.com, I think. Anyway, you can also read the wiki article. I can put the links in the description. So that's the whole principle of vaccines: drinking some sewer water and hoping you'll become immune. And things have gone wrong with the supposedly deactivated, supposedly attenuated viruses. And to patent a virus, it has to be attenuated. I've covered that in previous broadcasts as well. So it cannot be a normal, natural virus. It has to be attenuated or deactivated in a way to be able to patent it. Let's go to the wiki article, of course. Whoa. Why is all... oh. Okay. Let's read this whole thing and then an article, just the intro, and then we can read the rest of this to have an idea of what they're talking about.
Viral vectors are tools commonly used by molecular biologists to deliver genetic material into cells. This process can be performed inside a living organism, in vivo, or in cell culture, in vitro. Viruses have evolved specialized molecular mechanisms to efficiently transport their genomes inside the cells they infect. Delivery of genes, or other genetic material, by vector is termed transduction, and the infected cells are described as transduced. Molecular biologists first harnessed this machinery in the 1970s. Paul Berg used a modified SV40 virus containing DNA from the bacteriophage to infect monkey kidney cells maintained in culture. 1. In addition to their use in molecular biology research, viral vectors are used for gene therapy and the development of vaccines.
Reminds me of nanosilver, colloidal silver. And this illustration shows how nanosilver destroys the cell walls of a virus. Want2know.nl. People can use Google Translate also. And I've talked about why it is important if people use silver, I use it regularly, that they also use probiotics to replace the bacteria that their gut needs to digest food, destroyed by the silver. And I don't say killed by the silver because viruses are not living organisms according to the scientists online. Don't know if they're scientists, I haven't verified it yet, if there are scientists that claim that viruses are living organisms. They copy their RNA into cells. So how can they do that when they're not alive? I wonder, little seeds of a tree are alive as well or not? So it depends on their definition. Perhaps it also has to do with patentability. Perhaps they may not patent a living organism. And well, parasites are definitely living organisms, right? And then bacteria, I'd have to check what their status is. So we can get into the viral vector later. First, more about the vaccines. A couple of key points. Further coverage, the Thomson Reuters trust principles. A couple of key points and then an article.
Brief: AstraZeneca to supply Europe with up to 400 million doses of Oxford University's vaccine at no profit. 1 minute read. June 13. Reuters, AstraZeneca plc. AstraZeneca to supply Europe with up to 400 million doses of Oxford University's vaccine at no profit. AstraZeneca announcement is not anticipated to have any significant impact on company's financial guidance for 2020. AstraZeneca costs to manufacture vaccine are anticipated to be offset by funding by governments. AstraZeneca agreement with Europe's Inclusive Vaccines Alliance, EVA, spearheaded by Germany, France, Italy and Netherlands. AstraZeneca agreement to supply up to 400 million doses of University of Oxford's COVID-19 vaccine, with deliveries starting by end of 2020. Source text for Econ, further company coverage.
So that was Reuters, and now we're gonna read the cityam.com article.
AstraZeneca CEO, coronavirus vaccine will likely protect for a year. Poppy Wood. Britain Health Virus Vaccines via Getty Images. A potential coronavirus vaccine spearheaded by AstraZeneca and the University of Oxford will likely provide protection against COVID-19 for a year, the pharma giant CEO has said. The British drugs firm this week began.
Unbelievable. So they claim it will likely protect for a year, and then they expect people to take it. Also, it looks like they've designed it and they create these vaccines in a manner that they can make money from it to keep people sick, not to cure people. For example, the New England Journal of Medicine reported that flu-vaccinated people tested positive for HIV about a decade ago. I've covered that in my previous broadcasts, scientific articles. And the Lancet is also rather renowned, how do you say, popular. Or should I read the CNBC article? Well, probably it's about the same, you know, they might all get their news from one source, don't know if that's Reuters, and then they rewrite it a little bit so that they all produce the same information or misinformation. In my previous broadcasts, I've covered the fact that people that spoke about 5G in the mainstream media have lied, that 5G is a health hazard, and that it's backed up by scientific reproducible tests we can do ourselves, so we're 100% certain of our case. And secondly, there are studies, independent studies, that prove beyond any reasonable doubt that 5G radiation is harmful, and it may increase cell membrane permeability so that the virus can enter the cells. And that's also what they do with the electroporation vaccines, the DNA vaccines that may have to go to 7 billion people, which can be used for extinction purposes to reduce the global population to 500 million. And with all these book quotes of people that want to reduce the global population, can anybody disprove this to me? That there are people, nobody can disprove that there are people that want to reduce the global population, some to 500 million, some think that's not sustainable, that we have to go as low as 100 million. And these YouTube videos in which they claim these things are not considered triggering, they're loud, and thus people have every reason to be concerned about this stuff. So we have to use every legal means possible to prevent this population reduction to 500 million, and people that advocate this population reduction are a threat to humanity, and in reality the earth is not overpopulated. Jens, a Dutch reporter, also covered it recently in one of his broadcasts. Good broadcast, so check his channel if you're Dutch. And perhaps you can use the closed captions, translation, to see what he's saying. But then there may be others that also cover this. There's a video, or there was a video, perhaps it's still on YouTube, How to Beat the New World Order, in which they explain that the world's global population, 8 billion people, would fit into Australia, have their own piece of land and more than enough to eat if they divide the earth's wealth equally among men, and then the rest of the world would be uninhabited. So these people are making stuff up as they go along to reduce the global population. They're using propaganda, misinformation. The CIA controlled mainstream media, Project Mockingbird, allegedly, to brainwash everybody with the same lies. If they repeat that lie over and over, there's a book about it by Anne Cameron, The Sleeping Room, then at a certain point people start to believe it, is what they claim. But I have my doubts about it. I did a self-hypnosis, and I can advise everybody to do a self-hypnosis so no one can hypnotize you without your written permission, and so you never kill yourself, because that's what they're trying to make us all do, of course. And they're using directed energy weapons to silence people. And it boils down to the fact that people that advocate this population reduction are in violation of the Genocide Convention, and they should be arrested, not applauded. and the government's job is to protect and serve the tax-paying citizens, not to reduce the global population and tyrannize people into submission with directed energy weapons and slurp adrenochrome.
Human trials of the possible vaccine in collaboration with the University of Oxford, with clinical testing entering its third phase. Read more. Coronavirus, Imperial College vaccine set to begin human trials. We think it will protect for about a year, said AstraZeneca Chief Executive Pascal Soriot on Belgian radio station Bell RTL today. Soriot's comments, if true, place the AstraZeneca vaccine firmly ahead in the global race for coronavirus protection, as the death toll from COVID-19 tops 432,000. The firm now says it is on course to deliver 2 billion doses of the drug by the end of the year. Shares in the firm were up 1.4%.
So another important point I've made recently is that people cannot talk about these things without a proper disclaimer, because then it's considered triggering. And I've read that they remove any criticism of the WHO, basically. And people can find other examples of disclaimers, a legal disclaimer and a medical disclaimer online. So mine might not be best. I forgot to claim that I don't accept responsibility for any of your actions based on what you've seen in this video. And most of it is information produced by others. I'll show the sources of the information, and I keep clear what the legal means are that we can use to prevent this population reduction, to prevent mandatory vaccination, to keep it voluntary. I gave a top 10 of reasons to keep vaccination voluntary, why it may never be made mandatory, compulsory, obligatory. So I'm not going to cover that now. Let's continue reading.
Percent to 8,401.45p at 10.30 am. The pharmaceuticals company last weekend confirmed it had signed contracts with France, Germany, Italy and the Netherlands to supply the European Union with up to 400 million doses of the potential vaccine by the end of 2020. AstraZeneca has also made deals with the UK, the US and vaccine alliances to supply more than 700 million doses. It will also distribute 1 billion doses of the potential vaccine to low and middle income countries via the Serum Institute of India. China, Brazil, Japan and Russia have also expressed interest.
So what we could do is look at how many people live in France, Germany, Italy and the Netherlands. Just go to worldometers.info and click on population, world population, top 20 countries, population by country. It's the second option here. And then what's also interesting is that the United States has 25 more confirmed cases and 25 times more deaths, coronavirus deaths, than China. So then I will use my calculator. Why is the Windows key not working? Is it just taking too long? That's of recent as well. Already pressed enter, so it should load. Okay, the article. France, Germany, Italy, ad blocker was disabled already. So that's why it's weird that that appeared, because I already disabled it. So apparently the disabling of the ad blocker is not functional. Then we can use the other one. France, Germany, Italy and Netherlands. Alright. France, 65,273,000. Let's close this first. $65,273,511 plus Germany, Germany or Germany, 83,783,000. Already pressed plus 83,783,942. Whoops. Plus Netherlands, 70,134,872. Plus Italy, 60,461,826 plus, that's just 226 million. France, Germany, Italy and Netherlands to supply the European Union with up to 400 million doses of the potential vaccine. So then there are probably other countries in the EU that they want to supply to as well, 400 million doses, because there are 226,654,000 people in France, Germany, Italy and the Netherlands together. So then they would only need 226 million if they'd want to give it to everyone in these 4 countries. So that's a lot of vaccines. And of course they can still make money from it if they get the production cost from the taxpayers. Then the taxpayers still have to pay for that, of course. And they can perhaps make money on certain things, for example the ingredients. They might just overcharge tremendously. So how is that going to be checked, each of these ingredients, what the real cost is? So that's the point. It's going to set back the taxpayers a lot of money. Or is it paid by someone else? If the government pays for it, then the taxpayers are paying for it. And the money to produce it has to come from somewhere, of course. Unless they say, well, we produce it and supply it for free. We don't need any money from anyone. We're rich medical companies, the medical cartel, so we can do this for free. We don't need any money. They use the word free in this article, not in the CNBC article. it was in at no profit. Here it says it's Reuters.com. So that's why I thought that at no profit, so that's not for free. It still costs money. So we can read the rest of that article that we can read on cityam.com. And I'm sure that if I use another browser that it won't be a problem. And I had already turned it off, so the second time I pushed this, I turned it on in the broadcast, and then I turned it off again. But this disable my ad blocker message is still appearing. Well, let's just continue reading.
If all goes well, we will have the results of the clinical trials in August to September, and we will be ready to deliver from October if all goes well, said Soriot. The firm yesterday reached a deal with New Jersey-based Catalent to finalize manufacturing and packaging for the vaccine. As part of their agreement, Catalent will help AstraZeneca.
So I wouldn't take the vaccine for $1 billion. I'm also chemically sensitive and electrohypersensitive, and it usually goes hand in hand according to Dr. Cyril Smith.
Produce hundreds of millions of doses of the drug, beginning in August, a spokesperson said. Last month, Soriot told the BBC, the question will be whether it actually completely clears the virus or stops people from being sick. Read more. AstraZeneca approaches Gilead about potential merger. The UK government has given the University of Oxford £65.5 million towards the development of the vaccine. AstraZeneca said that it will not take any profit from the vaccine should it be rolled out during the pandemic. It comes as Imperial College London last night confirmed it will begin human trials of its own development of a coronavirus vaccine on human subjects later this week. The government has put £41 million towards Imperial's development of a vaccine, while an additional £5 million has been donated through public philanthropy.
I forgot which one we're reading. I'm also rolling in the meantime. So this City AM article doesn't have the word philanthropy in it. Let's see if it's still in the clipboard watch. Where is the Poppywood article? What's going on here? Was it another article in here? Ah. Okay, wow, that's so tricky. So it somehow opened another article on City AM. Perhaps I clicked somewhere because of the message that my ad blocker would be on, supposedly, which it wasn't. And then it moved to from the AstraZeneca CEO coronavirus vaccine will likely protect for a year by Poppy Wood, 16th of June 2020. It's now the 18th. It moved to the other one, the other article, AstraZeneca to supply Europe with 400 million doses of Oxford coronavirus vaccine by Joe Curtis. And meanwhile, GlaxoSmithKline hopes to produce 1 billion vaccine booster shots next year. I also made a blog the Ebola Pandemic Prevention and Survival blog. So check that out. That's this one. So it has more information about these companies that produce vaccines. And why does it have to be a vaccine? Needless needles. There are so many other ways to administer this. But perhaps they weren't happy with the oral polio vaccine either. They're hard to please. So here you can find lots of pages with data about the Ebola loss at Tegmira Camera and the people involved in that. Though the videos are not available anymore, that doesn't matter. And of course, I know more than ever before, thanks to the internet and people that are warning their fellow humans about their population reduction methods. And I'm now a truth teller and conspiracy factist, and at the time I made these blogs I wasn't yet. So let's learn more about these viral vector vaccines.
Viral vectors are tools commonly used by molecular biologists to deliver genetic material into cells. This process can be performed inside a living organism, in vivo, or in cell culture, in vitro. Viruses have evolved specialized molecular mechanisms to efficiently transport their genomes inside the cells they infect. Delivery of genes, or other genetic material, by vector is termed transduction, and the infected cells are described as transduced. Molecular biologists first harnessed this machinery in the 1970s. Paul Berg used a modified SV40 virus containing DNA from the bacteriophage to infect monkey kidney cells maintained in culture. 1. In addition to their use in molecular biology research, viral vectors are used for gene therapy and the development of vaccines. Contents: 1. Key properties of a viral vector. 2. Applications. 2.1 Basic research. 2.2 Gene therapy. 2.3 Vaccines. 3 types. 3.1 Retroviruses. 3.2 Lentiviruses. 3.3 Adenoviruses. 3.4 Adeno-associated viruses. 3.5 Hybrids. 4 Challenges in application. 5 See also. 6 References. 7 External links. Key properties of a viral vector. Viral vectors are tailored to their specific applications but generally share a few key properties. Safety. Although viral vectors are occasionally created from pathogenic viruses, they are modified in such a way as to minimize the risk of handling them. This usually involves the deletion of a part of the viral genome critical for viral replication. Such a virus can efficiently infect cells but, once the infection has taken place, requires a helper virus to provide the missing proteins for production of new virions. Low toxicity. The viral vector should have a minimal effect on the physiology of the cell it infects. Stability. Some viruses are genetically unstable and can rapidly rearrange their genomes. This is detrimental to predictability and reproducibility of the work conducted using a viral vector and is avoided in their design. Cell type specificity. Most viral vectors are engineered to infect as wide a range of cell types as possible. However, sometimes the opposite is preferred. The viral receptor can be modified to target the virus to a specific kind of cell. Viruses modified in this manner are said to be pseudotyped. Identification. Viral vectors are often given certain genes that help identify which cells took up the viral genes. These genes are called markers. A common marker is resistance to a certain antibiotic. The cells can then be isolated easily, as those that have not taken up the viral vector genes did not have antibiotic resistance, and so cannot grow in a culture with the relevant antibiotic present. Applications. Basic research. Viral vectors were originally developed as an alternative to transfection of naked DNA for molecular genetics experiments. Compared to traditional methods such as calcium phosphate precipitation, transduction can ensure that nearly 100% of cells are infected without severely affecting cell viability. Furthermore, some viruses integrate into the cell genome, facilitating stable expression. Protein-coding genes can be expressed using viral vectors, commonly to study the function of the particular protein. Viral vectors, especially retroviruses, stably expressing marker genes such as GFP, are widely used to permanently label cells to track them and their progeny. For example, in xenotransplantation experiments, when cells infected in vitro are implanted into a host animal, gene insertion is cheaper to carry out than gene knockout. But as the silencing is sometimes nonspecific and has off-target effects on other genes, it provides less reliable results. Animal host vectors also play an important role. Gene therapy. Main article. Gene therapy. Gene therapy is a technique for correcting defective genes responsible for disease development. In the future, gene therapy may provide a way to cure genetic disorders, such as severe combined immunodeficiency, cystic fibrosis, or even hemophilia A. Because these diseases result from mutations in the DNA sequence for specific genes, gene therapy trials have used viruses to deliver unmutated copies of these genes to the cells of the patient's body. There have been a huge number of laboratory successes with gene therapy. However, several problems of viral gene therapy must be overcome before it gains widespread use. Immune response to viruses not only impedes the delivery of genes to target cells but can cause severe complications for the patient. In one of the early gene therapy trials in 1999, this led to the death of Jesse Gelsinger, who was treated using an adenoviral vector. 2. Some viral vectors, for instance gamma retroviruses, insert their genomes at a seemingly random location on one of the host chromosomes, which can disturb the function of cellular genes and lead to cancer. In a severe combined immunodeficiency retroviral gene therapy trial conducted in 2002, 4 of the patients developed leukemia as a consequence of the treatment. 3 of the patients recovered after chemotherapy. 4. Adeno-associated virus-based vectors are much safer in this respect as they always integrate at the same site in the human genome, with applications in various disorders, such as Alzheimer's disease. 5. Vaccines. A live vector vaccine is a vaccine that uses a chemically weakened virus to transport pieces of the pathogen in order to stimulate an immune response. 6. Viruses expressing pathogen proteins are currently being developed as vaccines against these pathogens, based on the same rationale as DNA vaccines. The genes used in such vaccines are usually antigen-coding surface proteins from the pathogenic organism. They are then inserted into the genome of a non-pathogenic organism, where they are expressed on the organism's surface and can elicit an immune response. An example is the hepatitis B vaccine, where hepatitis B infection is controlled through the use of a recombinant vaccine, which contains a form of the hepatitis B virus surface antigen that is produced in yeast cells. The development of the recombinant subunit vaccine was an important and necessary development because hepatitis B virus, unlike other common viruses such as poliovirus, cannot be grown in vitro. 7. T lymphocytes recognize cells infected with intracellular parasites based on the foreign proteins produced within the cell. T-cell immunity is crucial for protection against viral infections and such diseases as malaria. A viral vaccine induces expression of pathogen proteins within host cells similarly to the Sabin polio vaccine and other attenuated vaccines. However, since viral vaccines contain only a small fraction of pathogen genes, they are much safer and sporadic infection by the pathogen is impossible. Adenoviruses are being actively developed as vaccines. Types retroviruses main article. Retroviruses are one of the mainstays of current gene therapy approaches. The recombinant retroviruses such as the myelonemurine leukemia virus have the ability to integrate into the host genome in a stable fashion. They contain a reverse transcriptase to make a DNA copy of the RNA genome, and an integrase that allows integration into the host genome. They have been used in a number of FDA-approved clinical trials such as the SIDX-1 trial. 8. Retroviral vectors can either be replication competent or replication defective. Replication defective vectors are the most common choice in studies because the viruses have had the coding regions for the genes necessary for additional rounds of variant replication and packaging replaced with other genes, or deleted. These viruses are capable of infecting their target cells and delivering their viral payload, but then fail to continue the typical lytic pathway that leads to cell lysis and death. Conversely, replication-competent viral vectors contain all necessary genes for variant synthesis, and continue to propagate themselves once infection occurs. Because the viral genome for these vectors is much lengthier, the length of the adenovirus's main article, adenovirus as opposed to lentiviruses, adenoviral DNA does not integrate into the genome and is not replicated during cell division. This limits their use in basic research, although adenoviral vectors are still used in vitro and also in vivo experiments. 16. Their primary applications are in gene therapy and vaccination. Since humans commonly come in contact with adenoviruses, which cause respiratory, gastrointestinal and eye infections, majority of patients have already developed neutralizing antibodies which can inactivate the virus before it can reach the target cell. To overcome this problem, scientists are currently investigating adenoviruses that infect different species to which humans do not have immunity.
Well, my theory about this thus far is that I think that this vaccine will not be mandatory, that they plan on a globally mandatory vaccine. Not just graphics, but also other companies. And Bill Gates talking about it, of course. He said in his videos, you can check his channel on YouTube, it's gonna have to go to 7 billion people. So they already know that. Adeno-associated viruses. Hybrids, challenges in application. And of course, giving this to chemically sensitive people would be murder, and then they should be held responsible. Is it true that these companies will be legally immune even if the vaccine would be contaminated or not deactivated properly, and everybody would die from it? Would they be held accountable, or would they say, well, it had to be rushed through, that's why we made these new laws, the legal framework, so they can do this without any repercussions if anything goes wrong? And they supplied it for free, at no profit basically, no cure, no pay. Well, perhaps it's best to show off my new hat and sunglasses. Cool or what? Construction worker hat without gear inside. So this is to shield against electromagnetic fields, against cell phone radiation especially. it's totally aluminum, not 528 Hertz, I think. And it's about 25 bucks. And I put tape on the inside so that the aluminum is not in direct contact with my head. So that it protects, it shields against the radiation, especially higher frequencies. And I've done a great review about the EMF 390 measuring instrument. You can also check that on my channel. Viral vectors to deliver genetic material into cells, okay? So if you want genetic material in your cells, then you have to take this. A live vector vaccine is a vaccine that uses a chemically weakened virus to transport pieces of the pathogen in order to stimulate an immune response. So it's only weakened, it's not completely deactivated, is that correct? That's the source glossary. I need to know the number. If I click on it, number 6 in the glossary. It just says glossary and a link perhaps. AMFAR, Making AIDS History, amfar.org. Page not found. So that's wiki link that's not found. A reference, number 6 here, to transport pieces of the pathogen in order to stimulate an immune response. And then it links to glossary, and it links to a page that is not found. What can I do now? Donate now. Put your euros in my paywall. I don't have a paywall yet, though you can donate to me if you'd like via universalpeace.jimdo.com. And of course, I'm doing this stuff to create a perfect society in which we all will live happily eternally, possible because of the neural networks, robots, the nanotechnology, and especially the scalar technology, the radiant energy of Nikola Tesla, the patents that I've covered in my previous broadcast about this subject. And my other channels are TrySomething.vegetarian and the Future channel on YouTube. And this is Perfect Society, so it's about perfecting society, saving the maximum number of human lives, and making everybody eternal. And I'm convinced this is possible because everything is energy, all is vibration. So let's read that vaccines part again to see if we get anything they write here.
A live vector vaccine is a vaccine that uses a chemically weakened virus to transport pieces of the pathogen in order to stimulate an immune response. 6. Viruses expressing pathogen proteins are currently being developed as vaccines against these pathogens. Based on the same rationale as a DNA vaccines, the genes used in such vaccines are usually antigen-coding surface proteins from the pathogenic organism. They are then inserted into the genome of a non-pathogenic organism, where they are expressed on the organism's surface and could elicit an immune response. An example is the hepatitis B vaccine, where hepatitis B infection is controlled through the use of a recombinant vaccine, which contains a form of the hepatitis B virus surface antigen that is produced in yeast cells. The development of the recombinant subunit vaccine was an important and necessary development because hepatitis B virus, unlike other common viruses such as poliovirus, cannot be grown in vitro.
So, if it's an antibody-dependent virus, could this vaccine be effective or not? And we read about what the professor said, or it was the title of a YouTube video. Let's see if I can find the text. Professor says only 10% of people with coronavirus develop antibodies. Daily Mail. Oh, that was an article, okay. I thought the YouTube video title, perhaps.
Professor says only 10% of people with coronavirus develop antibodies.
So, these viruses can also be good viruses. Using the antibodies to enter cells, I think. Don't know if I'm correct about this. Of course, I'm not a doctor, not a pseudoscientist. Not an allopathic professional. And it can be a good thing because they can kill tumor cells, for example, these viruses. If they're programmed correctly, you could argue it's a form of programming, basically. I found the Daily Mail article. Wow, I'm so fast.
Professor claims only 10% of coronavirus patients develop antibodies, meaning it may never be possible to measure true scale of pandemic. Professor Carol Secor said the majority of people would not have antibodies, they would have had the virus, but their immune response was different. Some parts of the immune system remain a complete mystery. It means it may never be possible to measure the scale of the pandemic. An estimated 8.5% of people in England have had the virus, the government says, but this is based on antibodies. Scientists believe the true figure is far higher. Here's how to help people impacted by COVID-19. https://www.dailymail.co.uk/news/article 8396195/ Professor says 10 people.
Okay, so I'm loading another browser because apparently there's something wrong with the Opera GX ad blocker. So I've noticed that on other sites as well. And of course they may have sabotaged it by controlling the mind of the programmer with synthetic telepathy that has been around since 1974. So that's not a weird idea. The Malig pattern makes it clear. Remotely monitoring and altering brainwaves. Download update. Well, I'm first loading the article now, hopefully. So that was annoying, and because of this I haven't heard what it read, so I'll read it again. And I am going to do the update also, so they can block it indefinitely. with wireless energy, the radiant energy patent of Nikola Tesla I've covered in my previous broadcasts. And they've tortured my teeth out of my mouth and my mother to death with these directed energy weapons. And allegedly it's done by the Jesuits in control of the intelligence agencies, which are all Masonic according to the illustration on Citizens Action Network on Facebook. So you can Google that for yourselves, and nobody has been able to disprove it to me. And it's kind of an important matter, so that's why I think they should do that.
Professor claims only 10% of coronavirus patients develop antibodies, meaning it may never be possible to measure true scale of pandemic. Professor Carol Sikora said the majority of people would not have antibodies. They would have had the virus, but their immune response was different. Some parts of the immune system remain a complete mystery. It means it may never be possible to measure the scale of the pandemic. An estimated 8.5% of people in England have had the virus, the government says, but this is based on antibodies. Scientists believe the true figure is far higher. Here's how to help people impacted by COVID-19. By Vanessa Chalmers, health reporter for Mail Online. Published, 1310 BST, June 7, 2020, updated, 1841 BST, June 7, 2020. Email 4.3K shares, 762. View comments. Only 10% of people who are infected with the coronavirus develop antibodies, a professor claims. Professor Carol Sikora, an advisor to the World Health Organization, said the majority would have a negative result on an antibody test, even though they have had the coronavirus. Governments have pinned their hopes on antibody testing to understand how much of the population has been infected to guide the easing of lockdown. These people, given the nicknames immunoprivileged or the COVID elite, would be able to return to work or socially mingle with an immunity passport. But not everyone who has had the virus will produce detectable antibodies, and may have used a different immune response in order to attack the virus. For example, T cells are one of the first lines of defense and act before antibodies are even needed. Some parts of the immune response remain a complete mystery to scientists and are unable to measure. It means it may never be possible to measure the scale of the pandemic or pick out those who have definitely had the coronavirus and have some sort of protection. Surveillance testing suggests that 8.5% of people in England have ALR.
It's very hard to copy the text, to read it for blind people, because it's not scrolling down. When I scroll down, basically it scrolls extremely slowly to select the text you want to read, so you can only read it with, you also read all the things that are on the side of the article basically, and related articles. So that's Daily Mail Co. UK. It used to be better. It looks more like Express Co. UK now. Or was that another website? Have they always done this? I don't know.
Surveillance testing suggests that 8.5% of people in England have already had the coronavirus, based on measuring antibodies. But scientists say the true figure is likely to be far higher. Carol Sikora, a former World Health Organization director, said the majority of people would have a negative result on an antibody test, even though they have had the coronavirus +5. Carol Sikora, a former World Health Organization director, said the majority of people would have a negative result on an antibody test, Even though they have had the coronavirus, governments have pinned their hopes on antibody testing, pictured, a blood sample, to understand how much of the population has been infected to guide the easing of lockdown +5. Governments have pinned their hopes on antibody testing, pictured, a blood sample, to understand how much of the population has been infected to guide the easing of lockdown. Antibodies are proteins that develop in response to a foreign pathogen over a few days. They are also created when a vaccine that imitates a virus is injected. The immune system remembers the antigens so that if a person is exposed to it again, it can produce antibodies quicker. These antibodies are present in the blood, and the have you had it tests are used to identify people who have previously had COVID-19. Professor Sikora, the chief medical officer at the Cancer Center Rutherford Health, told Mail Online, "If you have antibodies, you are essentially immune privileged or among the COVID elite. You are exempt from the rules because you are likely immune, are not likely to get it again, and are not likely to pass it on."
Well, another idea is that their tests cannot be effective because if people have one variant, one SARS-CoV-2 variant in a cell somewhere, then how could they test positive? And it can, of course, replicate its RNA, copy its RNA into these cells. So it wouldn't show up in the tests basically if it was only one variant infecting one cell.
But there is a snag, and that's that less than 10% of infected people have antibodies. That doesn't mean only 10% have been infected. Probably far from it. There are other immune defenses at play, but we can't measure that. The immune system is a huge web of proteins that have different functions to protect the body against infection, and antibodies are just part of the picture. Professor Sikora.
So it's just another piece of information that points in the direction of an antibody-dependent virus, isn't it?
Said the immune system is very sophisticated and there is a huge amount to uncover about how it works, especially in response to a novel coronavirus. He said, "There is what we call immunological dark matter. We don't understand it, but it's definitely protecting us. It may be one of the protections against the virus. Antibodies, which latch onto the coronavirus and mark it for other immune cells to destroy, are part of the adaptive immune system. The adaptive immune response is much slower to respond to threats and infections than the innate immune response, which is primed and ready to fight at all times. The innate immune system is the immediate response to the virus, or the first line of defense. It includes some T cells, which both kill the virus directly and stimulate other immune cells to join in." Professor Sikora said there is a hint that older people produce antibodies more often than those under 30 years old, and those who are more severely ill. But other than that, there is nothing to identify them. There is nothing about racial characteristics either. It's quite a mystery. He added, "What you need is a test to identify those you don't need to worry about. The problem is developing a test that is really specific, and we don't know what to measure." His comments follow research which shows most people who recover from the novel coronavirus generate a weak antibody response to SARS-CoV-2.
T cells, it's true. Immune, it's T.
Researchers from Rockefeller University in New York City looked at blood plasma samples from 149 recovered patients. They did not use an antibody test. They found every patient's immune system seem to be capable of generating the types of antibodies that neutralize and inactivate the virus, just not particularly enough of them. In fact, the neutralizing effect was undetectable in 33% of donors. The investigators say this may be because their immune systems cleared the infection before antibodies could be produced. They found that the effect was very high among 1% of patients, the so-called elite. Gus Dalglish, a professor of oncology at University College London, told Mail Online he believes the majority of people fight the virus with T cells, based on research so far. He said, if you have a good T cell response, it will protect you against the flu, the cold, or the coronavirus. This immune response declines dramatically over the age of 50, which fits the people who get ill more quickly with the coronavirus. Antibodies are a clear sign of many other infections. With this coronavirus, it doesn't appear to be quite as clear. It hasn't stopped governments globally moving full steam ahead to buy millions of antibody tests in order to measure the size of the pandemic. The Department of Health and Social Care have secured 10 million antibody tests being conducted on NHS and social workers in the UK now. Health chiefs have lost at least £20 million trying to find one that reaches their standards. Health Secretary Matt Hancock said the deal with pharmaceutical companies Roche and Abbott was an important milestone because it meant people on the front line could finally find out if they had been infected. In the long term, the public may also be able to get their hands on a Have You Had It test, either one that is sent to the laboratory or conducted from the comfort of your own home.
Okay, I was trying to find an illustration about antibody dependence. I found another one that may be nice, and I need the white background, so then I can use that as well. Turn off the time traveling neural network. Okay. Antibodies bind antigens on the surface of target cells. NK cells CD16 Fc receptors recognize cell-bound antibodies. Cross-linking of CD16 triggers degranulation into a lytic synapse, and the tumor cells die by apoptosis. But if this is a bioweapon, which it is according to some senators, and a new study proves this beyond any reasonable doubt according to scientists, it's about RATG13, so people can Google that, Nerd Has Power. And I've covered it in previous broadcasts. Then it could be designed not to destroy tumor cells, but to destroy or kill healthy cells that we want to keep, basically. That's the idea. And where's my other antibody dependent illustration? And I want to add another one. So this was the whole broadcast. I'm now just going to think about the information we've been presented with, basically. In the meantime, we can read while I'm getting the image. Oh wow, there's information in the chat. Thank you for your chat remarks. Simply simple. Am I going to The Hague the 21st of June? What's What's in The Hague the 21st of June? I don't think so, but I can think about it. If it's a protest against disproportionate coronavirus measures, 5G. Or what was the other thing? If it's against mandatory vaccination, then I would seriously consider it. People think they drink adrenochrome blood, but it goes via an IV, an infuus in Dutch. I don't really think you even read the chat. I heard it's 2 doses per person. That's interesting, thanks. Yo, live streams is a two-way street. Lol. Yes, I do read the chat remarks regularly, but lately I haven't had any chat remarks in broadcasts, so then it's kind of a waste of time when I'm checking the chat all the time. But I try to respond and read all your comments, and to avoid anything that YouTube might have a problem with. Words, there are 270 words that are not allowed by YouTube. So I want to be fully in compliance with the YouTube user policy. And that's also why I use disclaimers. But I've shown the antibody dependence illustration in previous broadcasts. It's nice, so I thought it would be nice to have that on now. So can anybody disprove to me it's an antibody dependent virus and it's still mutating? It's definitely still mutating according to the experts and scientists. So then the antibodies that people make will be for the unmutated version of it, basically, because it's continuously mutating. Let's see what Sam Vecnan wrote about that. I'm against compulsory vaccination because herd immunity is statistical, unquote. It's enough that 60 or 70% get the vaccine, no need to impose it on 100% of the population. But I think that's one of the worst reasons, but they might see that as a good one. Quote from 10 Plagues of COVID-19 video on Sam Vecnan's channel. Antigenic shift mutates twice a month, only 8 distinct strains of this virus. And immunity puts selective pressure on the virus, so it is forced to mutate, another reason to keep vaccination voluntary. That's more or less what he said. That's not an exact quote. Only the quote that I gave is an exact quote. Against compulsory vaccination because herd immunity is statistical. But I made a top 10 of reasons to keep it voluntary, and there are no good reasons to make it mandatory. I found it. So I called it 2019 nCoV mutating ABD. At that time, when I came up with this theory, it was still called 2019 nCoV. It's now SARS-CoV-2 and COVID-19. The virus is SARS-CoV-2 and the disease COVID-19. Yeah, but I wanna show another illustration from the Event 201 pandemic exercise. So many people have been studying whether this is or could be a zoonotic virus. So I'll first prepare it then, and then show what's going on, why it's taking so long. And theoretically that's because they sabotage everything I do. So this is from Event 201, video you can find online. It's pretty suggestive, isn't it? But it was just an exercise, and though chances are less than 1 in the middle, speech errors are made with synthetic telepathy, so very funny. Though chances are less than 1 in a million that they pick the correct virus for their pandemic exercise, nobody thinks, oh, that's kind of weird, isn't it? It cannot be a coincidence, because there are over 1 million viruses and they just happen to pick the right one, coronavirus. They don't think that's strange. They don't think that's strange. So, I'm not surprised. People don't think for themselves anymore, they just believe all the mainstream media lies. And perhaps we should look at that Malcolm X quote. Oh yeah, what I wanted to show is I should be able to put the picture in this picture slideshow. I can also do it on desktop. Plus image. Event 201 pig. Okay, the name is already in use. Event 201 pig 1. Browse. And here we see all these pictures in screenshots. Supposedly. Oh, perhaps I put it in animated GIFs. That's why I couldn't find it. Okay. Then I can remove this one. I just wanted to show to you all that it wasn't found. Remove. So it mainly sabotages the people by controlling the brainwaves and programming them with lies via mainstream media, but also social media websites. And they have controlled opposition, fake resistance, the round of real resistance, etc. All that may be true. So now I should be able to find the image, animated GIFs. Okay. Event 201 pigs route of transmission. Okie dokie. And then I can show this image without flickering, because if I use my picture viewer for that, image I, then I can show these images on the desktop like this. But if I hover my mouse pointer over them, then it starts to flicker. So if I make it full screen like this, there's no way to make that flickering stop. And when we use Open Broadcaster software, FREEWARE, OBS 2508, 64 bits, then we can show these animated GIFs And you can make them with a freeware program called anyway, it's a freeware program that you can use for it. You place it over the video and then you can make an animated GIF out of it, which uses a lot less of the computer's memory. These videos can take up quite a bit of memory and CPU. So you can have hundreds of animated GIFs going on simultaneously on your screen, but most people cannot handle hundreds of videos simultaneously. Well, it looks pretty convincing to me. The meek shall inherit the earth, blah blah, antibody dependent. Though it's a mistranslation, the Bible is still read more than the Torah, basically. And of course it's known that Muslims and Jewish people don't eat pork, swine, pig, meat. So will they finally be rewarded by the fictional deity who created these religions anyway? So religion is psychological warfare, part of the real warfare. I've explained it on previous broadcasts. Religion is an illusion. To quote Freud, religion itself is the abomination, not religious people, because they were misprogrammed with a lie. People have lied to them. And some wonderful, awesome religious people exist. So I'm not against religious people, only against religion itself. I'm for religious people. That's why I'm telling them the truth about this, because these 5 places we can go after we die, better world, etc., don't exist. If people die, they die for the rest of eternity. If people die, they die for the rest of eternity, and that of course means gazillions of years. And because of the speech error, I forgot the rest of the things I wanted to say. And they're also erasing memory selectively. So these 5 fictional places, heaven, hell, bottomless pit, resurrection and reincarnation, don't exist. It's made up. Something to reduce the global population by a time-traveling neural network. More about it in my previous broadcasts. And the big virion is placed over the genitalia of the pig, pork, swine, whatever. So when people eat cadavers, if they cannot stop eating cadavers, then I advise them to slice it. What is in plakjes in English? In small pieces that can be heated to 80 degrees Celsius for 1 minute. And also check if you're not vegan. I'm practically vegan. I do eat honey, and that's about all I eat basically, qua animal products. Vegan cheese, vegan burgers, vegan sausages, merguez, very nice. And now they also have the Beyond Burger. don't know if I've tried it already. I don't know where people can get it, but I've heard about it, and if it's plant-based and without GMO, then I can buy that as well. But if it's way too expensive, I doubt it. It may be really nice. So I'll have to give it a try so that I can talk about it. Without having tasted it, I can't say if it's any good. But it sounds better than a burger, so it's not a Bilderburger. So this was a thoroughly sabotaged broadcast. I'm gonna have to look at my ad blocker thing. Very annoying. Thank you all for watching. Please like, subscribe and share on your timeline. And when I'm not broadcasting, I'm not having any speech problems. I practice regularly for my broadcasts. Yeah, share this and other more important info on your timeline for a better future for humanity and yourselves. Makes sense. Let logic reign supreme because they also control human emotions. And that's the Hatayama patent, also referred to in the Malech patent that I've covered. And many people leave this out, so I keep that in my broadcasts. Because it definitely is an influence on our timeline and our future. And my claim is that a fair trial is impossible because they also control the judges with this technology, either with or without their knowledge nor consent. So the brainwave is electromagnetic. The only thing that can protect us against brainwave alteration is a Tesla plasma shield. Tea tree oil is scientifically proven to be antiviral. People can also use eucalyptus and Google natural cures to prevent this virus from spreading, of course. And the blocking working cures. A colloidal silver shipment sent to Africa was blocked in the time of that Ebola Lassa Tegmira Chimera pandemic, which was injected according to sources online, and it fits in with the Lancet article about the Ebola vaccine of Merck, M-E-R-C-K, and they're lying to you all. That's what it boils down to, either knowingly or unknowingly. So then you could argue they're speaking untruth, they're not lying, if they're convinced of it themselves. But people that want to reduce the global population use this satanic inversion technique, and they can always claim they were joking. The famous Kissinger quote, "The illegal we do immediately, the unconstitutional takes a little longer," is an example of that. And Global 2000 is real. So are there book quotes and the $1 Million Georgia Guidestones speeches and actions that speak louder than words that prove beyond any reasonable doubt that there is a conspiracy to reduce the global population. So I would not be creating a perfect society, but hell on earth, a non-fictional dystopia, if I would not tell my fellow humans about that. That's the way I look at it, and they should be arrested. They're not doing us a favor. So thank you all for watching. Kiss for single ladies who would like one, and see you all next time on Perfect Society. As soon as there is another important subject, then I will cover that. Thank you all for your chat remarks. 2 doses per person. Well then, if that were true, then it would be 450,000. That needs 450,000 and not 400 million. I mean 450 million and not 400 million. And also the question is, why is Bill Gates talking about 7 billion vaccines and not 7.78 billion vaccines? So yeah, check my other broadcasts on this channel. I I fixed it so that you can view all videos. If you scroll down on my channel page, then at the bottom click twice on load more videos, then you get an overview of all the videos on my channel. And that was, quote, sabotaged, unquote, as well. So that may be done by the AI, not by YouTube or the hackers that did DDoS attacks on my modem during certain broadcasts. So I'm not accusing YouTube. YouTube is awesome for allowing us to stream. And again, certain topics that I've covered cannot be covered without a proper disclaimer to avoid nasty situations. Thank you all for watching. Tune in next time. Perfect Society. And please like, share and subscribe. And see you all next time. Peace out. It's not going well today.